Hi, I'm Skinny Quinoa Sticks. I started eating these last night. It has quinoa, rice, and chia. It says the serving size is 26 sticks. Servings per container, 6.5. I'd say I had 3 servings last night. What's up guys? Welcome to my channel. I'm Nurse Blake, and in this video, I'm going to talk about how to rock your nursing clinical. Number 1, be on time. If this is your first day at a clinical site, make sure you get there early enough. You never want to be late. I remember those students who would always come in late and I'd just be like, I always remember the late students who would come to clinical and it would drive me crazy. And actually some clinical instructor, why can't I talk today? Let's try this again. And actually some clinical instructors will send students home if they are late. So if it is a new clinical site for you, I recommend you go there a day or two early just to make sure you know how long it takes for you to get there. And you also know where you're going. But sometimes people aren't gonna go there the day before. I get it, I know. So instead, I wake up really early that day and I make sure I get there really early. And typically, I'm either on time, like right on time, or 45 minutes to an hour early. But with me, I always know every morning I need to go to Starbucks, a drive-through, to start my day right. So I always make sure I calculate that into my time. If you have to drop off kids at school, you need to stop and get an energy drink, make sure you do that beforehand and make sure you do that early. You never want to be at clinical late. Item number 2, do your homework. You should have a basic understanding of what the patients you see on this clinical are going through, what medical conditions they have, what type of procedures they might go through, what medications they're on, and what their outcome is, or what does their discharge education look like? So if you're going to be doing clinical on a med-surg floor that specializes in oncology, make sure you review your oncology section in your textbooks. And make sure you really study up on that patient population. If you're going to be going to a cardiac floor, you better make sure you know your basic cardiac conditions, medications, and procedures. You never want to arrive at clinical unprepared because you're caring for these patients. You're gonna have patients and families that you're gonna interact with and care for. To give them the best outcome and to give them the best experience, you have to make sure that you're ready and prepared. So always review what you need to before clinical so you're ready, not only for yourself, but more importantly for your patient. Item number 3, make sure you bring all your nursing equipment with you. You never want to leave a stethoscope or a pen light back at home, because then you can't complete your patient assessment. And then you have to end up asking your professor or the nurse you're following or another student for their equipment. And then you're just taking equipment off the floor and out of someone else's hands. So always make sure you're ready and prepared. So the night before clinical, make sure you have all your stuff and put it in the bag that you take to clinical with you. So things I always like to take at clinical are a stethoscope, a pen light, my medication drug guide, my notes on that patient population and what I need to expect. Anything else you could think of, anything else you need for a clinical, like scissors. I always make sure I have scissors with me so I don't have to borrow it from somebody else. Set all your equipment out early so you don't forget anything at home. And don't leave your equipment somewhere where you're gonna forget it when you walk out the door, because then you'll have nothing. So you can even go ahead and put it in your car the day before so you know you have it with you and so that you're prepared for clinical. Item number 4, ask questions. This is your chance to ask as many questions as possible. If at any time there's something you don't know, don't pretend like you know it and don't ever think you don't need to know it. Ask. This is your chance. You're in nursing school. Clinical is the time where you need to learn as much as possible. This is gonna be when you make mistakes. Mistakes are gonna happen. You're not gonna remember something. That's all okay, because those things you go through are gonna help you become a better nurse. But you have to learn from these experiences. And if there's something you don't know, feel free to ask. Ask a nursing student, ask the nurse you're following, ask your clinical instructor. and they'll be able to help guide you and give you a direction or answer. And if you think that you know it all and you don't need to ask any questions, I have a tip for you. Always ask yourself why. Why is this patient sick? Why are they in the hospital? Why are they on this specific medication? Why are they on that dose? Why is that patient going to the procedure? Why are we drawing certain labs on this patient? And if at any time you don't know the answer to that why question, that is a chance for you to ask those questions. You're a student, you're supposed to learn. You're paying to be there in nursing school to learn. And you never want to be ripped off, right? If you order a Starbucks, you don't just leave it on the counter and let it get cold and just walk out without it. You want to take your Starbucks with you because you paid for it. That's the same with your education. Look at it that way. You're paying to be educated. So if you have questions, ask them. And it not only benefits you, asking questions and gaining knowledge is going to benefit the patient and their family. And last time I checked, that's why we're in nursing school. So we can help patients and we can help families. Item number 5, stay engaged. Listen, I know I was in clinical. You're gonna have time that's downtime where the patients you're caring for, there may nothing be going on. There may not be a lot going on with your patient. So it's really easy to just sit behind a computer and pretend like you're charting, or go chatting with one of your nursing school friends about the day, how boring and slow it is. And never say slow in a hospital, because once you say slow, you know what they say, it's gonna get really busy. Or if you ever say, oh, it's really quiet in here, that's the Q word. Never say that. Nurses will look at you and be like, oh, what have you done? And once you say those words, you know crazy stuff's gonna happen. It's gonna get really hectic. That's just an extra tip. Never say slow or never say quiet. But if it does get a little slow, the patients you're caring for don't have a lot going on, I challenge you to keep yourself busy that whole time. If your patients don't have any procedures going on, ask other nurses on their floor what their patients are going through. And if there's anything that you can observe or a skill that you can practice, tell your clinical instructor you haven't practiced Foley's or you've never inserted a Foley. I'm sure they will help you seek out that opportunity. Keep yourself busy, always stay engaged. And I'm sure there's always something more that you can learn about your patient. So really dig through their chart. Don't just look at the last note, but look at every note. Don't just look at the last labs on that patient. Look at every lab and really see their trends. And by staying engaged, you're learning, you're asking questions. There's something special about inquiry. And as a nurse and a nursing student, that is a skill. Inquiring is always learning, because it is so busy to just get caught up and, oh, it's just another clinical. It's another 8 hours. But clinical, this is hands-on experience. You get to be with patients and families. You're in the hospital setting. There is so much to learn. I've been working in hospitals for 8 years now, and I've worked at many different hospitals. I think I've seen it all, but honestly, I haven't. And whenever I am in the hospital, I try to learn more about every process. My last point I want to make, let's say you know you want to be in the neuro ICU treating adult patients when you graduate. And you know that's your job, that's what you want to do. Don't think that your clinical on labor and delivery is just a waste of time, because it's really not. Anytime you could be with patients, caring for patients, there's always something that you can learn. And things that you learn on an L&D floor or on a pediatric floor, you may not think it's important, but these things may come back when you're treating patients in the neuro ICU. So take every clinical as an opportunity to learn, an opportunity to grow as a nurse. Again, it's not about us, it's about what we can learn to care better for our patients. That's the main goal in clinical settings. Nursing school, we think the main job is to just get good grades and pass our NCLEX. But really, it's so much more. It's really about the people and the patients we care for. So think of every time and every minute and every second you're at clinical is a way for you to learn to care better for your patients. Because that's what matters, and that's why we became nurses. And I think there's something so special about always wanting to learn. Thank you guys so much for watching my video. I hope this video and these tips will help you rock your next clinical. and give you some extra things to think about. Make sure you subscribe to my channel, that big red subscribe button, make sure you click on that. There's also a little bell right next to that button, which will sign you up for notifications. And comment down below, and let me know what you thought about this video. Let me know where you're doing clinical, or if you have any other tips about clinical that may help another nursing student, leave that there. Make sure you share this with your nursing peers. Again, I'm Nurse Blake. You could find me on Facebook and Instagram, and you could also check out my website, nurseblake.com. And if you want to know my favorite nursing equipment, go down in the description below. I left you some links. Thank you so much for watching. I'm Nurse Blake, and have a great clinical.